My name is Blair. My name is Blair Horner, and I'm NIPERG's director and the MC for this morning's event. We have a few speakers, and then we'll take some questions. First, let me go through the media packet. I sent around to everybody this morning via email the media packet. It's and if people don't have it, please check your email addresses. You can also go to niperg.org. It should be posted there at 10 o'clock. I can't swear to it because I'm not looking at it right now. I'm looking at all you, but that is that was the game plan. And so there's a release, a 2-page press release, a 4-page letter from organizations supporting the legislation we're about to talk about, dozens of groups. There's a 1-page fact sheet from the Consumer Reports, NIPERG, and the Center for Food Safety, and then an infographic that was put out by the Centers for Disease Control and Prevention to show how antibiotic resistance can make it from farm to humans. And so that's the background materials. My role here today is to just sort of kick it off. And as many of you know, the world faces a growing public health threat, the rise of superbugs, antibiotic-resistant infections. Superbugs emerge from the use of antibiotics. The more you use them, the more resistant a tiny percentage become. We're now witnessing the rapidly increasing number of infections that are resistant. The world's public health experts, the World Health Organization, the U.S. Centers for Disease Control and Prevention, the New York State Health Department, all recognize this threat. The CD estimates that there will be 2.8 million antibiotic-resistant infections nationally this year and 35,000 deaths. Based on the CDC numbers, in the coming year, we estimate that translates into roughly 2,000 to 9,000 New Yorkers who will die next year from exposure to antibiotic-resistant infections. We're in a period like climate change crisis was 10 years ago, a growing threat that we have the tools to respond to act. But like climate change, if we don't act, the situation will become more dire. According to experts, unless the world responds by the middle of this century, more people will die from antibiotic-resistant infections than die from cancer. We're here today to support legislation that does just that attacks the issue with the best science and best practice advanced by the world's experts. And that legislation has been introduced in the Senate by Senator Kavanagh and Assemblywoman Rosenthal, who will now speak. Let me just turn it over first to Senator Brian Kavanagh, sponsor of Senate Bill S8847, if my eyesight is correct, who for years has sponsored legislation to preserve medically important antibiotics for humans and animals and protect the public health. Senator Kavanagh.
Thank you very much, Blair. And Blair, I know Blair will be recognizing our other speakers today as well. I just want to begin by thanking my colleague in the Assembly, Linda Rosenthal, who's been a great partner on this and on so many other issues. The COVID-19 pandemic has shown us that the real devastating effects that we can see from a illness that can spread rapidly and where there's no readily available treatment. For generations, humanity dealt with infections that are now considered minor, but were devastating in their own time because there was no treatment, because we did not have effective antibiotics. Antibiotics are one of the great miracles of medicine and have been astonishingly effective over the course, again, of generations. But overuse and growing resistance are beginning to undermine the benefits of that wonderful medical miracle. And in fact, people, as Blair noted, are already suffering severe illness and in some cases dying as a result. So this bill before us is intended to create a comprehensive approach in New York State that will ensure that we're doing everything we can to provide proper stewardship for these critical treatments, and not overusing them in a way that will be harmful to people. And that includes in the human health sector as well as in the animal production sectors of our society, which are a significant source now of antibiotic resistance. And Blair's analogy to the climate crisis, I think, really is apt. We do need to move fast. Some will argue that New York State can't solve this problem by ourselves, which is true both of this problem and of the climate crisis, and frankly of many other problems. But that is not a reason not for us to act vigorously, not to create a model that other jurisdictions could implement. So I'm very proud that we're moving this bill forward and look forward to getting it done. We have 30 days left in the session. I'm hoping that we can get this enacted in both houses by then. Thank you.
Thank you, Senator. And as Senator Kavanagh just mentioned, if this bill becomes law, New York would be the first in the nation to adopt the best practices and considered, it's called One Health, has been advanced by the World Health Organization and the CDC as a way to attack antibiotic resistance. Let me turn it over now to Assemblywoman Linda Rosenthal, who has a strong legislative history of success at the intersection of public health, animal welfare, and food safety. And she's the sponsor of the Assembly Bill A10097. Assemblywoman Rosenthal.
Thank you, Blair. Good morning, everyone. I'm Linda Rosenthal. I represent the Upper West Side and parts of Hell's Kitchen in Manhattan, and I'm chair of the Committee on Social Services. First, thank you, Blair. Thank you, NYPIRG. Thank you, Consumer Reports, and Doctors Price and Himes for joining us today. And of course, my colleague in the Senate, Brian Kavanagh. We collaborate on a lot of things, and we're a successful team. So we're looking forward to another successful effort. The world is going crazy, and so are we. And perhaps we can't perhaps affect all the politics that's going on, but perhaps when it comes to health concerns, we can actually make a dent in this eminently reasonable common sense bill. The last 2 years have wreaked such havoc on so many lives. People lost loved ones, they lost their jobs. COVID is not gone. It just keeps rearing its head in different ways. And it showed the way we in the world reacted to COVID showed that we're not prepared. We're not prepared for a global public health crisis of the scale at which we experienced it. And who knows what's lurking around the corner. And that's why the subject of antibiotic resistance has been well discussed in all quarters, yet nothing's happening to combat it, at least in our legislative role. We know that 65% of medically important antibiotics in the US are sold for use in food animals, cattle, cows, pigs, turkeys, chickens, but a majority of the animals receiving these antibiotics aren't even sick. Antibiotics are administered prophylactically so they can survive their wretched conditions, and often in cases overcrowded, unsanitary. Why not fix those? But that's not what happens. The US CDC estimates that 20% of antibiotic resistant infections originate in farm settings. And experts are warning that antibiotic resistance ranks along with climate change as one of the biggest threats we face as a people. As many of you know, I work on a lot of animal issues and work to protect animals and their welfare. But in this case, we've done not much. And I see antibiotic ineffectiveness as a looming threat, as do scientists and others around the world. And so that's why we need to pass this bill, as Senator Kavanagh and Blair Horner explained. I look forward to this continuing to work with this coalition and ensuring that, we as a people can survive instead of getting in our own way by passing this bill into law. Thank you all.
Thank you, Assemblywoman Rosenthal. As she pointed out, there is a coalition, it's a growing coalition of groups in support of the legislation. Roughly now 30 groups. You have that, the list of those organizations in your media packet. We turn it over to our next speaker. We're grateful to Dr. Saul Himes, Associate Division Chief Pediatric Infectious Diseases, as well as Medical Director, Children's Hospital Antibiotic Stewardship Program at Albany Medical Centers, Bernard and Millie Duker Children's Hospital, for rearranging his clinical schedule to be with us today. He's also served on the New York State Health Department's Antimicrobial Resistance Prevention and Control Task Force, which issued extensive recommendations in its 2018 STAR report. Dr. Himes works on the front line of this public health crisis, treating patients with antibiotic-resistant infections. Dr. Himes.
So thank you to Senator Kavanagh and Assemblymember Rosenthal, and to NIPERG and Consumer Reports and everyone else for your leadership with this bill. Thank you for allowing me to share my thoughts today. So as Blair said, I'm a pediatric infectious disease specialist, and I particularly work on and administer our antimicrobial stewardship program here at Albany Med Children's Hospital. And so it's in these roles that I see every day the impact that antibiotic resistance can have and what it means if we don't take urgent action on it. Antibiotic resistance is pretty straightforward from a science standpoint. Every time a bacteria is exposed to an antibiotic, whether that's an antibiotic that we take or that a farm animal is given, some of that population of bacteria will become resistant to the drug. It's selective breeding, no different than what turned wild cats into tabbies or wolves into dogs in our past. Alexander Fleming knew about this in the 1940s. He warned about it. We've known what was coming for 80 or more years, sort of this fear of a post-antibiotic era. And unfortunately, I can tell you it's actually here now. We're in it already. And despite COVID, despite climate change, which both keep me up at night, I have to say this is actually the thing that keeps me up at night most. This has the potential to be far more deadly and far worse of a pandemic than even the COVID pandemic, bad as that has been. To put things in perspective, Blair had alluded to 2.8 million people sick and 35,000 people dead. He gave great numbers in terms of what that means in terms of numbers of New Yorkers, but just to put what 35,000 people nationwide looks like, that's a third of my home city of Albany. It's a population of Elmira or Ithaca or Rome, to name some other towns in New York that are around that size. So, and in terms of the number of people who get sick, you're talking the entire population of Brooklyn. So this is a lot of people. What does it look like on a small scale? So this is some details of this have been changed, but I'm going to tell you a story. We'll say we've got an 8-year-old named Wendy, we'll call her for now, who's healthy, has never taken antibiotics before, goes to her doctor's office because she says it hurts when she pees, and they discover a UTI. They try to give her an oral antibiotic, which is a reasonable first choice, and she doesn't get any better. It turns out when they finally get the culture results that her antibiotic is completely resistant to oral antibiotics, only sensitive to IV. By this point, she's sicker. She has to go into the hospital. She needs IV medications. Because we have delayed a little bit because of not knowing that this was a resistant organism, she now has a kidney infection. She has to get anesthesia to have a central line placed so she can get antibiotics at home. She has to have home nursing. She misses school. Her parents miss work, but it's treatable. Unfortunately, this is already bad enough. This is something that one would consider a nuisance normally, a UTI, and thousands of dollars and many days of illness later, she's treated. But this isn't the end. There are a number of children who have urinary tract abnormalities that mean they get recurrent UTIs. And so as Wendy gets older, despite trying to fix the problem surgically, it doesn't get fixed. She keeps getting UTIs. And so every time she gets one treated, every time we treat one, the bacteria causing the next one is a little bit more resistant. So finally now, we'll say she's 15. She comes into the hospital in shock. She's septic from a UTI. She started on the same antibiotics she got the last time we treated her, but she's not getting better. And when her cultures come back, they call infectious disease to ask for recommendations about antibiotics for her, but I have nothing left to offer. Her infection is now resistant to every antibiotic that we have, completely untreatable. And so within the next day or two, scared, delirious, surrounded by tubes and machines, and hopefully her family members, this young girl dies of a UTI that we couldn't treat. Now, this sounds melodramatic, but this is not hypothetical. This is sort of a composite example of a number of patients who I have treated with this exact thing. And the number of times that I've had to tell a parent that we have nothing to treat their son or daughter with is far more than I would ever like to. This certainly not going to be the last. Really, the only way to prevent this, to keep antibiotics working, is to slow the rate of resistance. We can't keep breeding superbugs. We need to control how we use antibiotics, whether that's in people or in animals. And as was mentioned already, we need an approach that is really a One Health approach across humans and animals. What I do here in the hospital for our inpatients is a drop in the bucket compared to if you've got animals being given antibiotics. That's 65% of the usage across the country. And so really this bill is the perfect way for New York to try to address the whole picture. We're a state that's been a leader in healthcare before COVID, during COVID, and this bill allows us to continue to lead by making sure that antibiotic use in humans and animals is as judicious as possible, so that my patients, my family, the kids you can see behind me, everyone's families will have those antibiotics available for years to come. So thank you for your attention to this really important issue.
Thank you, Dr. Himes. Just remind everyone we'll have time for questions at the end of the remaining speakers. After that gut punch of a story, unfortunately, is the story for 35,000 Americans, is maybe as many as 2,000 to 9,000 New Yorkers next year. And so that underscores the need to act. I'm proud to introduce Dr. Lance Price, PhD, founder of George Washington University's Antibiotic Resistance Action Center, who most recently made headlines with his study showing meat labeled, quote, "no antibiotics," unquote, isn't always what it claims to be. In the laboratory, Dr. Price uses cutting-edge molecular approaches to track antibiotic-resistant superbugs in food animals and people. His research has been published in top peer-reviewed journals and covered in media outlets worldwide. Dr. Price, please.
Thank you. Just tried to unmute myself. Can you hear me?
Yes.
So thank you for that introduction. Senator Rosenthal, I think it's appropriate that you represent Hell's Kitchen, because I really do think that what we're doing on the farm is creating a sort of mini hell in our kitchen. And as you heard, sometimes in our bladders and our blood. And so, I'm a molecular microbiologist. As you heard, my specialty is to use DNA to track pathogens from, one source to people or among people. We help to identify the source of the Haitian cholera outbreak, showing that it came in with the peacekeepers. We identified a new strain of E. coli that kills more than 10,000 Americans each year. I also, did the work that showed the origins of livestock-associated MRSA in Northern Europe, and how it was the rampant use of antibiotics in food animal production that led to the emergence of this pathogen that now spreads to farmers and farm families. But my focus in the last few years is really apropos to what Dr. Himes was talking about, because I've been studying the bacteria that cause urinary tract infections. Most urinary tract infections are actually caused by E. coli that live in our guts. And so I've been really trying to understand, how do they get to our guts? How do these pathogenic strains of E. coli get into our guts? And so we've been applying these same really advanced DNA technologies. We've been developing new genomic technologies. And what we've found is that we estimate today that 480,000 to 640,000 UTIs in the United States per year are coming from the food supply. So now you think about all the antibiotics that we're using in the food supply, and what we're doing, we're fueling the growth of drug-resistant uropathogens, that is, pathogens that can cause urinary tract infections. And when we look at these bacteria, when we have the little tags that tell us these came from chickens or from pigs. And when we look at those pathogens, they're resistant to the same drugs that Dr. Himes would go to treat patients with UTIs with. And so it may be counterintuitive to think about somebody getting a UTI from food, but let me tell you how that happens, right? So use antibiotics in animals, you fuel the evolution of drug-resistant bacteria in the animals. They then, when you slaughter those animals, you contaminate the meat. When you handle that contaminated meat, you inadvertently contaminate surfaces, you consume those bacteria, sometimes you undercook, but they get into your gut, they grow, and then they make that short trip, sorry to be graphic, but from the anus to the urethra, and they set up shop. And then they can ascend from the bladder, they start growing in the bladder, and if treatment fails, they can ascend through the ureters into the kidneys and get into your blood and kill you. So that is the problem that we're trying to address. And one of the root causes is antibiotic use in food animal production. So we need to stop that, so that at least when this happens, until we get control of the pathogens in our food, at least when this happens, Dr. Himes has a drug to treat the patient.
Thank you, Dr. Price. As he mentioned, the legislation also deals with restricting the use of antibiotics on farm animals, in particular, not allowing the use prophylactically, as Assemblymember Rosenthal mentioned, on healthy animals, which is the part where it sort of crosses the line from using it for sick animals as compared to healthy ones. Let me now turn it over to Jean Holleran, the Director of Food Policy Initiatives at Consumer Reports for many years, is now a policy advisor with the Washington, D.C.-based Center for Food Safety. She's been a leader in marketplace efforts to reduce antibiotic use in animals, including the chain reaction scorecard to pressure McDonald's and other fast food chains on antibiotic use in food they sell. Jean.
Thank you. I would like to take a broader look at this because the situation is serious, but it could be really dire. We're now in a situation where resistance at the global level is extremely widespread. A study funded by the Gates Foundation, by the Wellcome Trust, by the UK government, and published in Lancet, the extremely prestigious medical journal, it found that in 2019, antibiotic-resistant superbugs were causing 1.29 million deaths around the world. That's more than the people are dying of malaria, more than people are dying of AIDS. That's the situation in 2019. Another study, also funded by the UK government, looked ahead and said, if we do nothing about this problem, by 2050, 10 million people will be dying every year. That's about the number of people who have died so far from COVID. This will be outstripping COVID as a cause of death around the world. What are causing these deaths? MRSA, skin infections, which can become bloodstream infections and kill you. Resistant lung infections, resistant pneumonias, resistant tuberculosis, which is something that has worried everybody. We have a little bit of it here, we've got a lot of it abroad. And if COVID has taught us anything, it's that bugs that exist abroad will all too soon come to the US. So this is a scary situation. We find it, we're using scary numbers because it is scary. And we commend very much Senator Kavanagh and Assemblymember Rosenthal for introducing this legislation. We need action, we need it fast, and we urge the legislature to move on this in this session. Thank you very much.
Thank you. And as Jean mentioned, the data is compelling. The experts around the world have given a blueprint as to what governments should do. As mentioned earlier, the One Health approach, which is essentially that states, governments should consolidate their antibiotic-resistant efforts in a way that is comprehensive and attacks the problem in all its facets. The legislation does that. It creates within the Health Department an Office of Antibiotic Resistance Control and consolidates data collection, both in clinical settings, community settings, and on farms. As I mentioned earlier, it also restricts the use, the overuse and misuse of antibiotics on farm animals, and essentially puts in one place all of the strategies the state is employing and adds new ones to make sure that New York does all it can and follows best practice. We'll now take your questions. If you have a question, please submit your questions in the chat option. Please indicate your name and organization and which presenter you would like to address your question to, if anyone specifically. Hopefully, Kevin, our tech whiz under the age of 30, behind the curtain, can unmute the person who sent the question as we discuss it. So let me just open it up right now. And Kevin, if you can make it easy for me to see the chat, I will also try to be as responsive as possible. Are there any questions? Kevin, do you see any in the chat?
No questions currently.
Okay. Well, we have been incredibly informative and I'm sure devastating to people that were listening to us. So if there are questions, I'll just filibuster a few minutes to give people time to submit them. I mean, this is the real deal. This is not something that we're worried about that only affects a handful of people. You've heard stories, you heard the statistics, you've heard the science. Now there needs to be a policy reaction to it. It's a serious problem that's only going to get worse. And New York State could be a model for the country, in fact, on how to address it. We know what to do. The best practices are out there from the world's experts. It's just a question now of political will and legislative action. We have tigers as sponsors in both houses, even with the waning weeks of session and all the distractions that we've all had to endure for those who follow state government. Nevertheless, that doesn't mean that problems that exist shouldn't be solved. And this is one way for New York to begin to solve it. Are there any questions, Kevin? Anything pop up?
No.
Okay. Well, then I thank you all for coming. I thank our speakers. Thankfully, Dr. Price did not have to commute in from down south to actually appear for us today. We are recording this and we will make the recording available on the NYPIRG YouTube channel soon, and we'll circulate it to anyone who is interested. Thank you all for coming and appreciate your time and effort, speakers, and talk to you all soon.